Welcome back to Visions Beyond. Today we're going deep on something everyone's experienced, digestive disorders. But before we get into it, don't forget to like, share, and subscribe to Visions Beyond, and leave a comment if you've got ideas for future deep dives. We love hearing what you're curious about. For this one, we've got a whole stack of sources, everything from common tummy troubles to, the really weird stuff. We've got common digestive disorders, symptoms and treatments, as for medical news today, digestive diseases from UF Health, digestive diseases, Medline Plus, Medical Encyclopedia. Then there's gastrointestinal diseases, symptoms, treatment and causes from the Cleveland Clinic, gut health, navigating common digestive issues, and 6 common digestive disorders from the Scope blog Tanner Health.
Okay, so everyone gets an upset stomach sometimes, right? But when does it go from, oh, ate too much pizza to, maybe this is something more?
That's where understanding digestive disorders is really key. These aren't just, tummy aches. They can really mess with your life, from those little annoyances to some serious medical stuff. Right, so not just like indigestion after a spicy burrito. Some of these articles mention things like untreated acid reflux, actually, like changing the cells in your esophagus. That kind of freaked me out.
Oh yeah, that's definitely something to take seriously. And it's important to remember the whole digestive system is crazy complex. It's not just one thing. It's this whole network working together to break down food. Then you got to absorb nutrients, get rid of waste. So when one part goes haywire, it can impact your whole body, really.
Okay, so before we get into the specifics, can we do like a quick anatomy recap, just so we're all visualizing the same, plumbing?
Sure. So imagine this. You take a bite of food, right? That's the beginning of the whole journey. First stop, your mouth. Chewing, saliva, that's where the initial breakdown starts.
Right, got to mush it up a bit.
Exactly. Then it goes down the esophagus into the stomach where it gets churned up, mixed with all these gastric juices.
Kind of like a washing machine for food.
Haha, yeah, but instead of getting clean, it's getting broken down even more. Next, it moves into the small intestine, and that's where the real magic happens. Most of the nutrients your body needs, they get absorbed right there.
Ah, so that's where those little villi come in, right? Those, finger-like things I remember from a biology class way back when.
Yep, that's them. They increase the surface area so you can absorb as much as possible. And finally, whatever's left over goes to the large intestine, absorbs some water, forms the waste product, and then, well, you know the rest.
The grand finale.
Yeah.
It's amazing how it all works, when it's working. But
yeah.
Clearly, things can go wrong. Let's talk about some of the common digestive disorders. I think we should start with something most people have experienced. Heartburn. I mean, we've all been there, right? That burning feeling, usually after you eat too much.
Oh, yeah, absolutely. Classic symptom of GERD, gastroesophageal reflux disease. It's basically stomach acid flowing back up into your esophagus, causing that burning you feel.
The Medical News Today article said it's not just spicy food that triggers it, though, right?
Right. A lot of times it's a weak sphincter muscle, the one between your esophagus and stomach. But diet and lifestyle are huge, too, like fatty foods, coffee, even chocolate can trigger it.
Wait, chocolate? No.
Afraid so.
Well.
And it's not just what you eat either. Like, pregnancy can cause GERD because of all the hormonal changes. It shows you how many different things can contribute to these conditions.
Okay, so speaking of things with lots of causes, let's talk about IBS, irritable bowel syndrome. Reading these sources, it seems like IBS is still kind of a mystery.
Yeah, it is in a lot of ways. The thing with IBS is it's what we call a functional disorder. So tests often don't show any structural problem in your gut.
Yeah, that's what confused me. Like the Cleveland Clinic source said, everything can look normal, but something's obviously not right.
Exactly. And that makes it hard to diagnose and treat. Plus, the symptoms can be all over the place. Abdominal pain, bloating, changes in, bowel habits. It varies a lot from person to person.
Like some days it's constipation, others it's diarrhea, sometimes it's, both. It's like your gut has a mind of its own.
Yeah, that's a pretty good way to put it. We don't totally get the causes, but we think stress, diet, maybe genetics, they all play a role.
So what can people do about IBS? Is there a way to, manage those unpredictable symptoms?
There are definitely things to try. The sources mentioned a few different strategies. For example, changing your diet, maybe getting more fiber, or trying a low FODMAP diet.
Okay, now I've heard of FODMAP, but I have no idea what it actually is.
It stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Basically, it's certain carbs that aren't absorbed well in your small intestine. They can trigger those IBS symptoms.
So cutting out certain carbs that your gut doesn't like. What kind of foods are we talking about here?
Things like lactose in dairy, fructose in fruit and sweeteners, fructans, which are in wheat, onions, garlic, things like that. It's about figuring out which ones are your triggers and limiting them.
So it's like a detective game for your gut.
You could say that. And the low FODMAT diet, it's more of a short-term thing, an elimination diet, not something you do forever.
Gotcha. So figure out the troublemakers and then adjust from there.
Yeah.
What about lifestyle stuff? Does that play a role in managing IBS?
Oh, absolutely. All the sources were big on stress management. Things like relaxation exercises, yoga, even therapy, they can help regulate your gut function.
That makes sense. I mean, we all know stress can mess with your stomach. Think about getting butterflies before a big presentation, right? That's your gut and brain talking.
Exactly. That's the gut-brain connection in action. And if stress is chronic, it can make your IDS worse, even lead to new digestive problems.
So managing stress is key. Now, what about those everyday things like constipation and diarrhea? They're not as mysterious as IBS, but they can still really impact your life.
You're so right. We tend to brush them off, but if you have chronic constipation or diarrhea, that can really mess with your quality of life.
So when does it go from, oh, this is annoying, to, I need to see a doctor about this?
Well, constipation is usually defined as having less than 3 bowel movements a week, and the stools are hard, tough to pass. Diarrhea is, well, the opposite. Frequent, loose, watery stools.
Okay, pretty clear definition. But there must be tons of reasons why someone might have either one, right?
Exactly. Could be something simple like dehydration, maybe you changed your diet, but it could be a sign of something more serious.
So if it's persistent, don't just ignore it. Now, we've talked about the common stuff, but these sources mention some digestive disorders that I'd never even heard of. Can we get into those?
Sure, ready for an adventure into the lesser-known parts of the digestive system.
Always up for an adventure, especially when it comes to learning new things. Hit me with the unusual stuff.
All right, let's start with Hirschsprung's disease. It's a mouthful to say, but thankfully it's pretty rare. Basically, people are born with it, and they're missing nerve cells in part of their large intestine.
So if the nerves aren't working right, the signals to, move things along get messed up.
Exactly, and that can cause severe constipation, even bowel obstructions in newborns.
Wow, this sounds really serious, especially for a tiny baby.
It is serious, but thankfully it's usually caught early, and they can fix it with surgery.
Okay, so rare but treatable. What about this one I saw? Achalasia. That one sounded interesting.
Ah, yeah, achalasia. This one mostly affects adults, and it's a problem with the esophagus. It doesn't relax properly, so food kind of gets stuck trying to get into the stomach.
So imagine trying to swallow and it feels like it's just stuck there. Ugh, that sounds uncomfortable.
It can be super uncomfortable, leads to trouble swallowing, chest pain, sometimes even regurgitating food.
Oh, wow. And how do you treat that?
Usually it's medications to relax the esophageal muscles, or they do procedures to widen the opening, the one between the esophagus and the stomach.
Makes sense. It's amazing how intricate the human body is, and when something's off, it can show up in all these crazy ways.
Absolutely.
Yeah.
And speaking of complexity, there's one more unusual one I wanted to mention, Menetrier disease. It's where the mucous membrane, the lining of the stomach, grows too much, creates these big folds in the stomach.
So, the stomach lining is getting too thick. What kind of symptoms does that cause?
That's the weird part. Some people get nauseous, vomit, have abdominal pain, but others, they don't have any symptoms at all.
Wow, that's strange. How can you have, an overgrowth of tissue and not even notice it?
It's a bit of a medical mystery, to be honest. We don't know exactly what causes Menetrier disease. Treatment is usually managing symptoms with medication, or sometimes they do surgery to remove part of the stomach, or even all of it.
Okay, so we've gone from everyday heartburn to things I'd never even heard of. It's a lot to take in, but I'm really curious about this gut-brain connection we touched on earlier. Is there more to that story?
Oh, definitely. It's one of the most exciting areas of research in digestive health right now. Your gut and your brain, they're in constant communication. It's like they're best friends texting each other nonstop.
Okay, I like that analogy, but how does it actually work?
It's this whole network of nerves, hormones, even the bacteria that live in your gut. And we're learning more all the time about how this communication affects both your physical and mental well-being.
So it's not just about, digesting food, it's about our overall health.
Exactly. And that's what we're going to dig into more in part 2 of this deep dive. So stay tuned. Welcome back to Visions Beyond. Picking up where we left off, that amazing connection between your gut and your brain.
Yeah, it's wild to think, what's happening in our stomach can affect how we feel, mentally. We were talking about stress. messing with digestion. But is it a two-way street? Can our mood actually impact our gut?
It absolutely can. Think about it. When you get nervous, do you ever get those butterflies in your stomach? That's your gut reacting to the stress signals coming from your brain.
So those butterflies are like a real thing, not just
Mhm.
in our head.
Exactly. And chronic stress, being stressed out all the time, it can do more than just butterflies. It can change the makeup of your gut bacteria, and that can lead to a whole bunch of digestive problems.
Okay, so stress management is important, not just for like our sanity, but for our gut too. What else can we do to keep our gut happy besides, not stressing out all the time?
Diet is huge. All our sources talked about how important a balanced, nutrient-rich diet is for your gut.
That makes sense. You are what you eat and all that, but figuring out what to eat, especially when you have digestive issues, it can be so overwhelming. There's like a million different diets out there.
Yeah, it's a lot. But let's break it down. First and foremost, real whole foods. That means lots of fruits, veggies, lean protein, whole grains. That's not just good for your gut, it's good for everything.
So basically the same stuff my doctor tells me for like general health. What about more specific things? Like we were talking about the low FODML diet for IBS. How does that fit in?
The low FODMP diet is a good example of a more targeted approach. Remember, it's all about reducing certain carbs, the ones that trigger IBS symptoms, like lactose, fructose, fructans, all those.
Right, the ones that can cause gas, bloating, and all that fun stuff.
Exactly. And it's not about never eating those foods again. It's about figuring out which ones you react to and then managing them.
Like a detective game for your diet. You got to eliminate the suspects, see who's causing trouble, and then like adjust accordingly.
Haha, I like that. And remember, the FODMP diet, it's more short term, like an elimination diet, not how you're supposed to eat forever.
Okay, good to know. What about fiber? I hear that's good for digestion, but the sources mention different types of fiber. Can you explain that?
Sure, there's soluble fiber and insoluble fiber. Soluble fiber, it dissolves in water and forms this gel-like thing. That helps slow down digestion and soften your stool. Think oats, beans, lentils, fruits like apples and pears.
Okay, so soluble fiber keeps things moving smoothly, let's say. What about insoluble fiber?
Insoluble fiber adds bulk to your stool, so it moves through your system easier. That's your whole grains, nuts, seeds, veggies like broccoli and cauliflower.
So we need both kinds for like optimal digestion. I'm starting to see how much of this is about figuring out what works for your body.
Such a key point. Everyone's gut is different. What works for one person might not work for another. There's no one-size-fits-all solution when it comes to gut health.
Speaking of individuality, there was something about probiotics that caught my eye. Do they actually help with digestive stuff?
So probiotics are live microorganisms, and when you eat enough of them, they can actually have health benefits. There's more and more evidence that they can be helpful for things like IBS.
But there are like so many different kinds of probiotics. How do you even know which ones to choose?
Yeah, it can be confusing, for
Yeah.
sure. The key is to look for strains that have been studied, scientifically and shown to actually work for what you need.
So not just any random bottle at the store.
Right. Some strains are good for like reducing bloating, others might be better for regulating bowel movements. It's best to talk to your doctor, honestly. They can help you figure out which ones would be good for you and what dose to take.
Makes sense. I'm noticing a theme here. Personalized care is really important for gut health, huh?
It really is. Paying attention to your body, experimenting, and getting advice from professionals. That's how you figure out what works for you.
It's a journey, not like a quick fix. And I think it's cool to remember we have more control over our gut health than we think.
I completely agree. And speaking of empowerment, we're going to wrap up part 2 of our deep dive here, but make sure you stick around for part 3, where we'll talk about specific things you can do to take control of your gut health.
We're back for the final part of our deep dive on digestive disorders. I feel like I've learned so much about what's going on down there in my gut.
That's great to hear. You know what they say, knowledge is power, especially when it comes to your health.
For sure. And we've covered a lot, from the basics, like how the digestive system even works, to some pretty weird and rare conditions.
And we talked about that gut-brain connection, which is super fascinating and something we're still learning about.
Right. But what I'm really taking away from this is that, we actually have more control over our gut health than we think.
Totally agree. And that's what we wanted to focus on in this last part. Practical things you can do to feel better, digestion-wise.
So where do we even begin? What are some, actual things our listeners can start doing, like today?
Well, I think it's important to remember everyone's gut is different. What works for your friend might not work for you. It's about figuring out what your body needs.
Makes sense. So it's not about following some strict rules. It's more about listening to your body and making changes as you go.
Exactly. And there are a few tools you can use for this. We've talked a lot about diet already, and that's huge for digestive health.
Right. But there are so many diets out there. How do you know where to even start?
Keep it simple. Focus on those real whole foods, lots of fruits and veggies, lean protein, whole grains. And don't forget to drink enough water. That helps everything move through your system.
Okay, so good advice for life in general applies to our gut too.
Yeah.
Makes sense. What about when things are like really not working right? What should people do then?
That's when you got to see a doctor. Don't just tough it out. Talk to your doctor if you have symptoms that stick around or just worry you.
Right, because what you think is just a stomach ache could be something more serious. Better safe than sorry.
Absolutely. Early diagnosis is key. And once you've ruled out anything major, then you can look at other things like stress management techniques, changing your diet, maybe even trying probiotics.
We talked about stress management. I think everyone can relate to that. Stress is just part of life, but you got to find healthy ways to deal with it for your mental and physical health, right?
100%. And with diet, it's all about experimenting. See how different foods make you feel. Some people keep a food journal. That can be helpful. It's about, figuring out what works best for your gut.
And if you're feeling lost or just overwhelmed by it all, don't be afraid to ask for help. There are people who can help, like registered dietitians. They can give you like personalized advice.
That's a good point. And remember, you're not alone in this. So many people have digestive issues. There are even like support groups out there where you can talk to people who get it.
It helps to know you're not the only one going through it.
Okay, so we've got diet, stress management, talking to your doctor. Anything else people should know as they start to like work on their gut health?
I think the biggest thing is to be patient and be kind to yourself. There's no like instant fix with gut health. It's about those gradual changes that'll make you feel better overall.
Yeah, it's a journey, not a destination, right? You'll have good days and bad days, but the key is to keep learning, keep trying things, and really advocate for your own health. Well said. And on that note, I think it's time to wrap up our deep dive into digestive disorders.
I feel so much more informed and kind of empowered too after this conversation. Thank you so much for talking to us.
It's been my pleasure. Really interesting conversation.
And before we go, don't forget to like, share, and subscribe to Visions Beyond. We've got more exciting deep dives coming your way, so stay tuned. And let us know in the comments what topics you want us to cover next. We love hearing from you.
Until next time, keep exploring, keep learning, and take care of those guts.